Bismillah. Assalamu alaikum wa rahmatullah. Today we are going to talk about the last section or lecture. This is the chronic diarrhea. Chronic diarrhea objectives. First, to understand the pathogenesis and pathophysiological mechanism involved in chronic diarrhea. To know how to evaluate a child who has chronic diarrhea, including appropriate elements of history, physical examination, stool analysis, and the blood testing. Be familiar with the many disorders that cause chronic diarrhea, both with and without failure to thrive or growth retardation. Know the therapies for the many causes of chronic diarrhea. Let's start by bloody diarrhea in infancy and children. Bloody diarrhea often indicates serious gastrointestinal disease. Many causes. To start with, the first cause is intestinal bacterial infection is the most common cause, such as Shigella or enteroinvasive E. coli, Campylobacter, Salmonella, Yersinia are important. In the developed world, bacterial gastroenteritis is usually self-limiting. Antibiotics are not needed, only needed in certain selected cases. Second, dysentery in the developing world. Other disorders including bacterial يعني dysentery it's a word that is ومصطلح ينطلق على bloody diarrhea وهاي bloody diarrhea اللي هي إذا كانت infectious هي dysentery either caused by bacteria or caused by parasite. إذا كانت bacteria هي most probably راح تكون dysentery أو other types of E. coli. Most of the bacteria that we mentioned above can cause bloody diarrhea. But أكثر شيء إحنا نفكر بالديزنتري ومثل ما قلنا it's a serious infection can include toxins that cause encephalopathy leading to CNS manifestation. And when the dysentery parasitic, usually the entamoeba histolytica is to be blamed for. بس الانتاميبا ما تسوي ذاك السيفير illness مثل ما تسوي لنا إياه الشيجيلا. يعني الشيجيلا أكو very very high grade fever، أكو toxic element اللي هو راح يسوي لنا encephalopathy and so. بينما انتاميبا histolytica fever not that very high. صح أكو tenesmus، أكو pain، أكو bloody diarrhea، بس the fever is usually not more than 38. 3. The autoimmune causes مثل inflammatory bowel diseases, Crohn's disease, ulcerative colitis often present with bloody diarrhea and should be considered in all ages. Vasculitis اللي هي autoimmune أما يكون autoimmune inflammatory bowel disease وأما vasculitis اللي هو مثل الهينوكشورلاي purpura and SLE systemic lupus erythematosus. 4. The milk protein allergy. 5. Surgical causes can give bloody stools or bloody diarrhea such as يعني مو شرط يكون عندنا diarrhea but any blood or the stools mixed can be one of the causes in this table, such as interception, malrotation, and valvulus, polyps, and Hirschsprung disease. 7. Necrotizing enterocolitis. Bloody diarrhea. Let's talk about amoebiasis. Human infection with entamoeba histolytica is prevalent worldwide. Entamoeba histolytica is a pathogenic organism in addition to other 5 non-pathogenic types. Ingested, it goes to the stomach, to the small intestine, and the gastric acidity and digestive enzymes. It exists and gives in the small intestine to form 4 trophozoites and colonize in the large bowel and may invade the mucosal lining under certain conditions which are not known. Clinical manifestation, most of us, 90 to 98% of Iraqi people and most of the developing countries, we have the cyst in our body, in our gut, in our colon. But this cyst is not pathogenic. تقريبا 90% من عندنا هو عندنا cyst. It is asymptomatic. بس in certain condition and stressful condition هذا الcyst ممكن ينفتح ويتحول إلى تروف اللي هو يسوي الأكيوت dysentery أو اللي هو amoebic dysentery. Intestinal amoebiasis هو second form of the infection. Incubation period 2 weeks إلى 1 month. Gradual colic abdominal pain, bloody mucus, frequent stool with tenesmus. Tenesmus يعني مغص. Tenesmus مغص while passing stools. Fever in 1/3 of the cases. The third presentation is amoebic colitis, mostly at the age of 1 to 5 years because usually comes from contamination. sudden onset of fever, chills, severe diarrhea sometimes leading to dehydration and electrolyte disturbances. Toxic megacolon and local perforation can happen, leading to peritonitis. Hepatic amoebiasis, hepatomegaly, and liver abscess occurs in less than 1% of the infected individuals, even in no previous infection. Fever, chills, elevation of the diaphragm with effusion or atelectasis. يعني عادة لأنه هي بالcolon فالcirculation from there can go to the portal vein. The portal vein passes through the liver and then it can confer the infection and later on leading to amoebic liver abscess, and this is rare, less than 1% of the infected individuals. Diagnosis, how to diagnose? It is based on detecting the organisms in stool samples. بس ما ألقي السيست وأقول هذا infection مال انتاميبا histolytica. لازم ألقي التروف. When I find the trough, I can say that this diarrhea is due to Entamoeba histolytica. Sigmoidoscopically obtained smears and tissue biopsy samples are rarely aspirated from the liver abscess. The trophocytes should be seen motile and containing RBCs. This is the picture of the Entamoeba histolytica, and we should see the trough containing the RBCs inside to say this is active infection. The treatment, all individuals with Entamoeba histolytica trophocytes courses should be treated. For invasive amoebiasis, oral metronidazole اللي احنا نسميه فلاجيل 50 mg per kg per day in 3 divided doses for 10 days. إذا كان عندنا cyst, is it wise to treat the cyst؟ لأن احنا كنا حامين الcyst. Theoretically, academically, we should receive treatment. For cyst, oral diloxinide 20 mg per kg per day in 2 divided doses for 10 days. For amoebic liver abscess, it should be intravenous treatment with metronidazole 7 mg per kg 8 hourly. What is the pathogenesis of persistent diarrhea? Final common pathway to persistent diarrhea is a prolonged small intestinal mucosal injury أو نسميه البسامة PSIMI post enteritis syndrome. يعني هو عبارة عن infection، وهذا الانفكشن بعض infection بس صار عندي sequelae مال هذا الانفكشن اللي أدالي إلى prolongation of the period of the diarrhea. هذا هو the most common cause behind chronic diarrhea in our country in the developing countries. ودائما تلقوا مع قوسين يحطوا post enteritis syndrome، وهذا أكثر شيء بالبلدان developing countries. It is rare in the developed countries. Basami is caused and intensified and perpetuated by the following factors. الإنسان يكون malnourished, ineffective villus repair, persistent infection with one or more enteric pathogen, malabsorption of nutrients, especially carbohydrates and fats, increased absorption of foreign proteins, deficient enteric hormones. All these factors contribute to the vicious cycle of the mucosal injury and persistent diarrhea. يمكن احنا هنا هذه نحكيها على مود نعلمكم شلون نفكر او شنو الميكانيزم. راح افهم الميكانيزم، راح افهم شلون اعالج مريضي او اقيم مريضي. Increased absorption of foreign proteins راح يصير وياي بالبسمة، لأن أنا صار عندي destruction على الليفل مال الفيلاي، فبقت هاي الفيلاي عايفة في مكانات مفتوحة تدخل من خلالها large particles of protein واللي راح تسوي لي persistence of the infection and persistence of the diarrhea. In persistent diarrhea, the small bowel mucosa is damaged and hence large protein molecules are absorbed intact into the bloodstream. This leads to the formation of circulating immune complexes that aggravate lipasemi. Classic examples of this phenomena are cow milk protein allergy intolerance and soy protein intolerance. Chronic diarrhea in infants and in toddlers and children are going to be discussed. يمكن نشوف هنا تسلسل، ويمكن شوية التسلسل هي تبقى نفس الكوزز، بس التسلسل يبدي يتغير يصعد ينزل according to the frequency and incidence of the cause. We have the carbohydrate intolerance and post-infectious secondary to lactase deficiency, celiac disease, cow milk protein allergy, toddler's diarrhea, infections as GRD and HIV, cystic fibrosis, acrodermatitis, enteropathic. Let's start by the common is common. Let's go to the carbohydrate intolerance. This is quite the most common cause behind chronic diarrhea in children. It's either primary congenital lactose intolerance, glucose, galactose malabsorption, very rare, usually starts early with watery, explosive diarrhea and failure to thrive. Reducing substance in stool is positive. يعني كل sugar يبقى reducing substance positive in stool. إذا لما أريد أقول هذا لاكتوز، خلينا نقول لاكتوز intolerance، إذا قسنا البي اتش راح يطلع قليل وريديوسينج سبستانس بالستول راح تطلع بوزيتيف. يعني هنا عندنا اللاكتوز وياها اكو جلوكوز جلاكتوز، ما راح نفكر بالجلوكوز جلاكتوز because it's rare. خلينا ناخذ البرايمري congenital lactose intolerance. السكند secondary lactose intolerance usually post infectious. احنا قلنا من يصير infection راح يصير damage to the villi. الراس الفيلاي راح يكون at the top of the villi اكو اللي هو اللاكتيز اللي هو ضمن اللاكتوز. من صار بها shedding راح اللاكتيز، صار عندنا some deficiency باللاكتيز، وهذا راح يعطينا السكندري لاكتوز انتولرنس. اذا الفرق مالته عن البرايمري انه هذا يتصلح بس ذاك لا، ذاك كونجنتال ابسنس. شلون نخليه يطيب من الانسان؟ نعطي مجال ناخذ حليب اللي هو ما بي لاكتوز، لاكتوز فري، نعطي مجال للفيلاي اللي هي تصير بها كومبليت هيلينج، واللي هو شوي ياخذ ما بين يعني تقريبا 4 to 6 weeks. Patient هنا usually at the bloating, abdominal discomfort and flatulence that occur from 1 hour to few hours after ingestion of milk or dairy product may signify lactose intolerance. The stool characteristics are loose, watery, acidic stools and often with excessive flatulence or flatus and associated with urgency that occurs a few hours after the ingestion of lactose-containing substance is typical. What investigations to be sent for the patient? Reducing substances in stool is positive. The stool is acidic, pH is less than 5.5. Breath hydrogen test. دائما الكربوهيدرات لما ما يصير بيها absorption, good absorption راح will be reflected، راح تعطي hydrogen in the breath. فلذلك راح نقيس أو we detect breath hydrogen test. Carbohydrates malabsorption results in bacterial fermentation of the unabsorbed sugar. Thus, carbohydrates malabsorption can be determined by measuring the exhaled hydrogen concentration after a carbohydrate load is administered to the patient. The management is lactose-free diet for 4 to 6 weeks. What about celiac disease? This is an immune-mediated inflammatory condition of the proximal small intestinal mucosa with permanent intolerance to dietary gluten, cereals as wheat, rye and barley. هذا عبارة عن immune disease to certain protein موجود بالبرولامين اللي هو موجود بالحنطة ومشتقات الحنطة اللي ناكلها. الحنطة والشعير وأشياء اللي احنا نعرفها بتسوي حساسية هي الحنطة ومشتقاتها. The etiology طبعا it's a lifelong sensitivity to gluten. Celiac disease is a multifactorial disease involving genetics and immunological susceptibility factors triggered by dietary antigen and other possible environmental factors. It is the prolamine which present in the gliadin of the gluten which is toxic للtoxic fraction. شلون ممكن يجي الإنسان اللي عنده حساسية حنطة؟ طبعاً incidence مالته quite common. أكو إحنا بالعراق عندنا underestimation. بالغرب تقريباً من كل 100 شخص أكو 1%، 100 أو يمكن بغير بلدان 1 200. بالعراق يعني ما نقدر نقول عليه قد الانسيدنس because we don't have that statistical value. Usually presented as 6 to 18 months، يعني من يبدأ الطفل ياخذ الحنطة. And there is variable periods between the introduction of gluten and the appearance of the symptoms. Breastfed children may have delay in the presentation of the disease. Diarrhea may be acute or insidious. Stools are pale, foul, offensive, smell large in amount. Failure to thrive and anorexia, short stature يأثر على نموه فتشوفه short, abdominal distension and sometimes vomiting. On examination, we can notice wasting. راح يصير malnourished child, wasting especially in the proximal parts, the hip girdle with increased wrinkling of the skin, sore throat, smooth tongue, picture مال iron deficiency anemia مع كل الفيتامينز deficiency, excessive bruising, clubbing of the fingers, peripheral edema, no weight gain. The weight and height are below the third centile for his age, iron deficiency anemia, megaloblastic anemia, skin manifestations sometimes such as dermatitis herpetiform, which is typical for the celiac. This is dermatitis herpetiform, typical مثل الهربس simplex اللي هي تكون عبارة عن blister with a fluid. This is typical. Below 9 months, acute onset of vomiting, severe diarrhea, abdominal distension, hypotonia, growth retardation, sometimes even constipation can be a presenting picture. Severe anorexia, hypotonia, marked abdominal distension. Older children, they might come with different presentation. يعني يبقى silent بس يجينا كshort stature أو delayed puberty أو severe iron deficiency anemia, rickets, personality changes, no obvious GI tract symptoms بس no part reflected or on any part of the body. وممكن يجينا asymptomatic spleen, ممكن يعني هو عنده فد أخ وهذا الأخو عنده celiac disease وجاني هذا، فأي لازم أي شيء يصير به لازم أحط ببالي إنه أنا أدور مثل أخوه إنه هذا ممكن يكون، لأنه أكو فد genetic predisposition فأدور على another celiac in the family. Diagnosis usually non-specific إذا أريد أخذ الcomplete والRBCs المورفولوجي، low serum albumin, increase prothrombin, low vitamin D، كلها هذه non-specific, but the specific are أسوي serological test for anti-transglutaminase antibody which is very sensitive, anti-endomeasial antibody very sensitive, and oesophagogastroduodenoscopy for small intestinal biopsy. HLA typing DQ2 and DQ8 are positive in patients with celiac disease. أي اثنين من ذولي ممكن يعطيني celiac disease. The typical finding in the second part of the duodenal biopsy, total or subtotal villus atrophy, crypts hyperplasia, increased number of crypts, and increased intraepithelial lymphocytes more than 30 per 100. The definitive diagnosis is by typical biopsy plus serology, and the follow-up is by serology or serology plus positive HLA. يعني إذا كان عندي serology وياها endoscopy اثنينهم يعطوني diagnosis، وإذا serology و HLA هم وحدهم اثنينهم يعطوني diagnosis. الfollow up مالتي شو راح يكون؟ راح يكون عن طريق serology. Subtotal villus atrophy can be seen also in cow milk protein allergy, IgA deficiency, familial villus atrophy, and eosinophilic enteritis. Differential diagnosis of celiac disease, Giardia can give exactly the same picture. Acute viral diarrhea with lactose intolerance, autoimmune enteropathy, stagnant loop syndrome with bacterial overgrowth, cow milk protein intolerance, familial villus atrophy enteropathy, and IgA deficiency, usually since birth. Complications is that of protein losing enteropathy and edema, dimorphic anemia, growth retardation and delay in puberty, bleeding tendency, celiac crisis, severe dehydration, shock, and severe hypokalemia. Long-standing celiac disease may lead to lymphoma, and that's why we should inform the family that it is not related to the time. هواي أهل يجون يقول لك كان يصير زين الطفل أنا أريد أرجعه ما يقدر أخوانه كلهم يأكلونهم، فلا, this is a lifelong. You should stay forever on the gluten-free diet. Treatment, gluten-free diet, symptomatic treatment for anemia and hypoalbuminemia and any super added infection, long life follow-up of the patient with compliance and growth measurements. These are pictures, and this is typical for the normal villi and the crypts, and this is the finding of a celiac disease patient, total absence or villus atrophy, and the crypts hyperplasia with lymphocytic infiltration in the submucosa. وصلنا لحد الcow milk protein allergy. Allergy usually starts when children are given milk products. Typically, symptoms are vomiting, diarrhea, colic, and constipation may occur. Other representation are wheezes, cough, atopic eczema, and behavioral changes like irritability, crying, and milk refusal. A challenge with milk-free times may have a good indicators. يعني نسوي له challenge نوبات من نقطع الحليب يشوف الطفل يرجع normal, active, healthy, suckling well, and may have good indicators. However, histopathological examination and non-diagnostic فيبقى challenge هو الوحيد اللي أشخص فيه. toddlers diarrhea called the chronic non-specific diarrhea of children. وهذه حكينا عليها one of the types of diarrhea بالمحاضرة الأولى. It is a common problem occurs in children mainly above 2 years of age. ويجيك الطفل كلش healthy و normal growth ويقمز و active very active. Investigations كلها normal, growth parameters are normal but frequent bowel motion. And it is a benign condition. Usually the children have no failure to thrive and they present in a good nutritional state. Abdominal pain may be present in a minority of them and the stools are foul smelling, watery and contain mucus with undigested vegetable materials. The parents are likely to report a short mouth to the anus transit time. يعني يقول لك أول ما ياكل عشان تطلع بطنه بس تشوف النمو مالته زين والانفستيجيشن كلها زينة. وغالبا ما يكون عندهم family history of the same condition بالكبار اللي نسميه irritable bowel disease. نجي إلى كوز كلش مهم اللي هو giardiasis in children. Giardia is one of the nastiest parasites in children. Giardia, one of the causes of very familiar causes and common causes in our country developing because of the poor sanitation and contamination. Giardia lamblia is a flagellated protozoa that infects the duodenum and the small intestine. Wide range of clinical manifestations result from asymptomatic, acute, and chronic diarrhea, even malabsorption status, just like the celiac disease. Infection is common in children, more common in children than adults. etiology يمكن بهذا السلايد موجود شوية معلومات عن نقراها ونحاول نستفيد من عندها. عن الجيارديا لامبليا، هذا شكلها الجيارديا تقريبا عندها فلاجيلا فلاجيلا وتيبيكال من يشوفها اللاب examinist. Clinical manifestation incubation period is around 1 to 2 weeks and the child may be asymptomatic or have acute watery diarrhea, maybe fever, nausea and anorexia. The stool initially may be profuse, watery and later becomes greasy and foul smelling and may float, constipation or normal bowel motion. Signs of fat-soluble vitamins deficiency, malabsorption of sugar, fat and weight loss. How to diagnose? Giardia usually more serious than Entamoeba histolytica. لأنه الإنتاميبا lives where in the colon. But the Giardia lives in the small intestine higher up ومن نوع اللي adherent تلزق يراد لها علاج intensive therapy. منو اللي أخطر؟ الانفكشن لما تصير بالcolon ولا لما تصير بالsmall intestine? Definitely in the small intestine will lead to more serious because she's going to compete you on your food. فراح تبدي تنافس الإنسان على الأكل مالته وراح تبدي تسوي في chronic illness and malabsorption state. Repeated fresh stool examination أو samples examination for the trophozoite, the cyst and Giardia antigen in the stool or duodenal fluid. Aspiration or biopsy of the duodenum or upper jejunum. Blood count is normal usually, no eosinophilia and giardiasis. Treatment metronidazole 15 إلى 25 mg per kg per day divided doses for 5 days. Furazolidine 6 mg per kg per day divided doses for 10 days. أو tinidazole 30 mg per kg per day single dose therapy. What about cystic fibrosis? It is an autosomal recessive disorder. Most patients have respiratory symptoms as recurrent pneumonia and adenoids. Those patients have pancreatic insufficiency which leads to diarrhea with greasy stools. يعني المشكلة وين هو بالترانسبورت مال كلورايد أيون. وهذا الكلورايد لما يصير بالسبيوتم بالميوكس ممبرين مال كل إنسان أنا أشبهه بعامل النظافة فيجيب وياه ووتر فيغسل. فإذا كان اكو abnormal transit أو transport of the chloride فتبدي تصير الميوكس ممبرين السكريشنز مالتها very thick وstagnation راح يصير overgrowth مال بكتيريا and gradual damage to the integrity of the mucous membrane. وإحنا نعرف كل جسمنا مبطن بالميوكس membranes ف it affects mainly pulmonary and GIT اللي هو أكثر شيء pancreas pancreas ending up with non-functioning pancreatic gland تبدي بالexocrine and later on بالendocrine part of it فأكثر شيء أكو chronic cough, أكو chronic diarrhea and malabsorption, and every part of the body lined with the mucous membrane will be affected. Failure to thrive genetic diagnosis and the sweat chloride test are main investigations. نسوي لهم sweat chloride test لأنه it is autosomal recessive inherited disease. راح تشوف more than one sibling in the family could be affected. فويا كل عائلة اللي عندها أكثر من طفل عنده repeated chest infection or chronic diarrhea يعني لازم أفكر هذا ممكن cystic fibrosis and I should send him either for genetic diagnosis واللي هو صعبا ما موجود عندنا بالعراق فممكن ندز sweat test. Acrodermatitis enteropathica, an autosomal recessive disorder as well, presented with perioral rash, chronic diarrhea, recurrent infection, and napkin rash resistant to treatment. راح تصير الراش راح تصير around all the orifices تبدي red and turning into black وننطي احنا treatment but there is no use and no response because the body is in demand for zinc. Usually starts at the time of weaning and tint red hair with alopecia. Diagnosis serum zinc is in the white feces or in the blood is very low and the treatment is with oral zinc and should continue on the zinc supplementation. This is typical acrodermatitis enteropathica. Look at the orifices, كل الorifices around which أكفت erythematous patches وبعدين turning into black. Chronic diarrhea of older children common causes يمكن هنا شوية صعدنا البوست enteritis syndrome وراها celiac disease, lactose intolerance, infections, Giardia and HIV, irritable bowel syndrome and inflammatory bowel diseases. Post enteritis syndrome حكينا عنه بالمحاضرة الأولى post enteritis syndrome وحتى بهاي المحاضرة بالبداية هم حكينا عن mechanism. Persistent diarrhea after gastroenteritis is caused by continuing infection, further infection, carbohydrate intolerance, post-infection malabsorption syndrome, and usually subsides. But severe cases may persist to longer periods. Stool analysis and stool cultures should be done. Treatment of the cause is usually beneficial. What about pseudomembranous colitis? Also called antibiotic-associated colitis or Clostridia difficile colitis, it is an inflammation of the colon associated with an overgrowth of the bacterial Clostridium difficile. This overgrowth of Clostridia difficile is most often related to recent antibiotic use. لذلك واحد من الأسئلة اللي كلش مهمة بكل كرونيك ديارية هل الإنسان ماخذ antibiotic؟ لا. هذا applied on the children as well. Stool sample, there are a number of different stool sample tests usually to detect Clostridia difficile infection in the colon. A blood test, these may reveal an abnormally high white blood cell count, leukocytosis, which may indicate pseudomembranous colitis. Colonoscopy and sigmoidoscopy, signs of pseudomembranous colitis, raised yellow plaques, lesions, as well as swelling. Treatment is with metronidazole. Orally لازم نتذكر treatment هو flagyl orally or vancomycin can be given orally as well but it should be oral not IV. Inflammatory bowel disease, this is of two types, Crohn's disease and the ulcerative colitis. 20% of cases present under 20 years of age. It has intestinal and extraintestinal manifestations. Clinical picture هي diarrhea, abdominal pain, growth retardation, weight loss, anorexia. Colonic Crohn's disease may be clinically indistinguishable from ulcerative colitis, with manifestations that include the following: bloody mucopurulent diarrhea, cramping abdominal pain, and urgency to defecate. يعني أكو فرق بين الألسرتيف كولايتس والكرونز. الكرونز ممكن يبدي من بداية GIT إلى نهايتها from the mouth or oral cavity to the anus. بينما الألسرتيف colitis من اسمه confined to the colon. Usually the lesions of the Crohn's are transmural while the ulcerative colitis تشمل الممbrane mucosa and the submucosa. Perianal involvement in Crohn's disease is quite common and may produce the following simple skin tags, fissures, abscesses, and fistulas, painful defecation, bright red rectal bleeding, perirectal pain, erythema, and discharge. Examination Growth is impaired, intermittent fever, tachycardia, mouth ulcers, anal tags, arthritis, erythema nodosum, pyoderma gangrenosum, tanner staging is important. يعني أنا مود أحدد sexual growth of the child. وطبعا الانفستيجيشن تتضمن البلد complete blood count, anemia, ESR كلش عالي, C-reactive protein usually positive, elevated, hypoalbuminemia. Imaging studied a single contrast upper GI tract radiological series with a small intestinal follow-through sometimes done. وما ننسى نوبات, why نوبات? Extra-intestinal manifestation can present years before the GIT. نوبات تدخل بالديفرنشال diagnosis POO, arthritis, anemia, joint manifestation. كل هذا ممكن يدخل يعني سنين يبقى المريض يشكي من هاي الشغلات complaining, and then later on GIT manifestation and diarrhea will start to show up. Diagnosis is by endoscopy, colonoscopy with several colonic and terminal ileal biopsies is considered the standard diagnostic procedure. Upper endoscopy or esophagogastroduodenoscopy should be part of the first-line investigation. Video capsule endoscopy is increasingly being used to evaluate for the small bowel Crohn's disease in children. Step-up approach. Patients with mild disease are treated with preparation of 5-aminoglycoside. يعني هذا هو الفيرست لاين مانجمنت. يعني ما نبدي رأسا بالسترونج treatment. يعني أبدي بسمبل وأعطي antibiotic and nutritional therapy. If there will be no response, we can start by steroids. We can start by corticosteroids, and then after the patient getting improvement, I can add some immune modulator therapy or cytotoxic drug. And the surgery is considered when the medical therapy fails. Indications for surgery include the following: intractable disease with growth failure, obstruction or severe stenosis, abscesses requiring a drainage, perianal fistula, and intractable hemorrhage and perforation. Thank you very much.